The first thing I'm going to do when I walk into the room, I'm going to introduce myself. Hi, I'm Lauren. I'm going to be your nurse today. How are you doing today? Oh, good. That's great. All right, I'm going to perform hand hygiene. And I'm just going to explain to you what I'm going to be doing today and make sure your guardian knows that as well. Hey, I'm just here I'm going to perform a normal head to toe assessment just to check on everything and make sure you're doing well. Can you give me your name and date of birth? Okay, perfect. If the patient wasn't old enough, I would ask the mom or the guardian or whoever is in the room with the patient and ask them to give me their name and date of birth as well. Okay, the first thing I'm going to do is, it's kind of hard to show on a video, so I'm going to explain that one of the things that I'm going to be looking for is making sure that they're growing normally for their age, make sure their height and weight is within normal limits for their age. I'm going to make sure that they have good hygiene, good oral hygiene, and I'm just going to monitor their level of consciousness and making sure that their mood is correct for this kind of stage of hospitalization. Okay, and the first thing that I'm going to do is I'm going to go ahead and I'm going to check your hair. I'm just going to feel around your head and make sure there's no bumps or anything. I'm going to feel your hair. Your hair is very soft. Did you take a bath today? Okay, you did? How often do you take a bath? Every day? Okay, that is great. That is fantastic. Okay, the next thing I'm going to do is I'm going to grab my pen right here and I'm going to look in your ears. I'm going to pull up and back and make sure there's no drainage or anything abnormal. Okay, now I'm going to shine this really bright light in your eyes and you just look straight. Okay, great, Mom. I'm just making sure that the pupils are reacting normally and making sure that everything is great with Perla. Okay, and it looks great. Okay, I'm just going to pull down your eyes. Make sure that conjunctiva is pink and the sclera is white. Okay, it's great. You look perfect. Okay, I'm going to look up your nose. I'm going to be looking to make sure there's no discharge, any blockages, making sure there's patency in the nose, and everything looks perfect. Okay, I'm going to move down to the mouth. I'm going to check in the mouth, make sure either that all the teeth is there depending on the age, or if they're missing any teeth, have a loose tooth, ask them if the tooth fairy has been there, anything like that, if they have a loose tooth. While I'm here, I'm going to be checking their oral hygiene, making sure that they're brushing their teeth every day. And then I'm also going to be looking at their oral mucosa, making sure it's pink and moist and intact, and it is right now, so everything looks good. Okay, the next thing I'm going to do is I'm going to go ahead and feel their neck and make sure the lymph nodes are normal and no swelling lymph nodes. Okay, perfect. Okay, while I'm here, I'm going to go ahead and just pinch the skin. And Mom, I'm just checking the skin turgor. This is just the way we check hydration and making sure they're good and hydrated. Okay. The next thing I'm going to do is I'm going to listen to your lungs and your heart and your belly. Okay. The first thing, I'm just going to put your shirt up real quick. Okay, and I'm going to assess the skin. I'm going to look and make sure their chest is rising and falling equally. Making sure they're not barrel chested. I'm going to look at their belly and make sure that it's flat and non-distended and make sure everything looks normal. Make sure there's no bruises, scratches, or anything like that. And if there is, I make sure to document it. Okay, the first thing I'm going to do is I'm going to check your lungs. Okay, perfect. I'm going to roll you over real quick and just listen to the back. And just keep taking a deep breath whenever I move the stethoscope. Okay, great. Alright, now I'm going to listen to your heart. I'm going to listen for a full minute to check your heart rate. Okay, great. And then I'm going to move on to your belly and I'm going to listen in all 4 quadrants and make sure that you have active bowel sounds. Okay, perfect. Everything sounds really great and normal. All 4 of your bowel sounds are active and nothing looks out of the ordinary with your respiratory rate or heart rate. Everything looks great. Okay, the next thing I'm going to do is I'm going to palpate the abdomen. Just let me know if you have any pain. I want to make sure that I'm not feeling any abnormalities or anything like that. And then I'm going to go through it again and just do it a little bit harder and make sure that they're not feeling any tenderness or pain in those areas. Okay, great. Alright, I'm going to pull the shirt back down. And while I'm here, I'm going to check the brachial pulses on both sides and then the radial pulses, making sure they're equal and strong. I'm going to go ahead and check their capillary refill on both hands. Then I'm going to feel your muscles real quick. And I'm going to just bend your arm and check their range of motion and make sure everything is going great. Okay, there's just a few questions I'd like to ask you. Are you having any trouble or having any coughing or trouble breathing or anything like that? No? Okay, Mom. Has he mentioned any trouble breathing or anything like that? No. Okay, that's great. Do you know when the last time he went to the bathroom for a bowel movement? This morning? Okay, that's great. Does he usually go normally? Normal every once a day? Okay, that's great. When was the last time he voided? Just about an hour ago? Okay, does everything look normal with that? Normal consistency, normal color? Has he had any trouble? Okay, that's great. Okay, the next thing I'm going to do is I'm going to pull your sheet up. And I'm going to look and I'm just going to assess your legs and make sure there's no bruises or anything like that. Looks like you've got a little bruise there. How'd you do that? Oh, you fell on the sidewalk? Oh, my son does that all the time. Does that hurt right there? No, it doesn't. Okay, you're tough. Alright, here I'm going to check the popliteal pulses. Make sure they're strong and equal on both sides. I'm going to go ahead and check the dorsalis pedis pulse. Perfect. I'm going to check your pedal pulse. Great. And while I'm here, I'm going to check the capillary refill on both of your feet. Okay. +2, that's perfect. Alright, now I'm just going to go ahead and I'm going to flip you over. And while I'm here, I'm just going to assess the spine, make sure it is straight and normal. There's no abnormalities, there's no lesions or anything like that on the back, and everything looks perfect that I'm looking at. I'm going to go ahead and check the rectal area and make sure there's no hemorrhoids or no redness or anything like that. And you look perfect. Okay, that's great. Okay, while I'm here, I'm going to go ahead and just bend your legs a little bit and do some range of motion. Can you push and pull on my feet? Push. Okay, now pull. Okay, great. You're a strong little boy, aren't you? Okay. The next thing that I'm going to do is I'm going to put some gloves on and I'm going to just assess your genitalia area. Make sure that everything looks normal, and it does. The external genitalia looks normal. Have you had any problems with it or anything? No? Okay, Mom, has he mentioned anything to you? He hasn't? Okay, I'm going to take my gloves off and perform hand hygiene. And I'm going to educate the patient or the guardian or mom, whoever's in the room, on how the head-to-toe assessment went. Let her know if everything looked normal at this point. And I'm going to make sure, throughout the assessment that the patient knows where they are, what time of day it is, and their name, and their parent's name that's with them or anything like that. Okay, I want to make sure that the bed is raised up to the normal height. Make sure that the bed rails are on. If the patient's head of the bed wants raised, then I'm going to go ahead and do that. And I'm just going to ask the mom if they have any questions or concerns or anything. If the patient has any questions or concerns or wants or needs, I'm going to ask them that, and then my assessment is complete.